Hi everyone, welcome back to the Dr. Sia channel. In the video here today, we're going to be talking about a particular form of trauma bonding that I call abuser bonding. Let's get started. Now, if you haven't seen my other two videos on trauma bonding, one is called the Stockholm Syndrome and the other one I think is called the victim bonding, please check them out as well. In this video, we're going to be talking about abuser bonding. Now, trauma bonding, and I have a separate video on what a trauma bond is, so check that out as well if you want to know more about trauma bonding more generally. But abuser bonding is a very particular form of bonding that happens between different types of attachments. So when you have a person who has a disorganized attachment that then gets together with another person who has a disorganized attachment, you get what I call abuser bonding. Now, the abuser bond is very particular because it requires a very specific set of hurts that are happening between the people who have this bond. Now, more often than not, what that looks like is that the abuser is two people. Now, a lot of people think that abuser bonding requires one abuser, and that might be true. It might be that one person is abusing the other, and the other is being abused by the other. In reality, objectively, that might and very often is the case, but a more particular psychological way to look at that is that in reality, in these people's minds, there often are two abusers. They're both abusively bonded to each other. And how that happens is like this. One person becomes the abuser and abuses the other, and then gets abused back, but then feels bad because they only were abused by the other because they did the abusing to begin with. Similarly, that other person doesn't want to abuse but gets abused, has to respond to the abuse with abuse, and then feels like an abuser for having responded to the abuse with abuse. Now, these two people don't have to sit in their passive or active positions. It doesn't have to be that this one is always the superior, the one who instigates the abuse, and then this one is the one who passively receives the abuse and then gives it back. It doesn't always have to be like that. They can also shift roles. So if this one starts becoming more passive, then this one takes on an active role of abuse. This person then responds to the abuse with abuse, and then now this person feels bad, and then this person feels bad. So abuse bonding is a very particular form of bonding that occurs off the back of children who were never really safe. They never had safety. All they knew is that continuous sensation of being abused and feeling horrid within themselves, feeling afraid, feeling hurt. That's the only kind of way that they could see life and see themselves and feel within themselves. So that kind of continues into their relationships. For people who are abuser bonding, when someone comes from the outside and tries to care for them too much, then they immediately kind of pull away from the relationship because someone who does not get into that dynamic with them just doesn't feel right. Now, what can you do if you or someone you know or a patient you know is in an abusively bonded relationship? Well, the first thing you could obviously do is to bring it to their attention. Now, in doing that, obviously, you need a bit of a rapport there already. You need a bit of understanding between you. They need to know that you're not coming from a harmful place. And if you're listening to this and going, oh my gosh, that's my relationship right now, I hope you don't take this too harshly. This is just the information that you can utilize now to take yourself off to therapy, to go read some books, to talk to the people you need to talk to learn about what you're going to do to get out of that abusively bonded relationship. Unfortunately, an abuse bonding relationship has not a lot of hope, or if any. And that's the sad news. abuse bonding relationships are not likely to be successful. They're just likely to be hurtful in the long run. So if you're waiting for the hurt to stop, it's probably not going to stop. And if you're waiting for your patients' hurtful relationships to stop, they're not going to stop. So we need to bring it to their attention that they have bonded abusively with the other, and that the other has bonded abusively with them as well. I hope you found this video useful. I'll be making a lot more videos on the different types of bonding that I coined and I term different things. So don't go look for these in literature. They don't exist. But obviously, if you've done a lot of reading, you can kind of tell the red thread that goes through here. I hope a lot of people are appreciating these and that you like these videos, because they've been videos that I've made because people have commented and said that they want to hear these, including my students or the psychologists or the psychotherapists. So if you are listening to this, please do drop that like, because it will make it more likely that other people will be able to see the video as well. Thank you so much, and I'll see you again for the next one.